Although I chose the therapy route of healthcare, I think that innately I gained so many of the baseline concepts of the nursing profession from my mom, and that was caring and compassion, and I'm able to take that into my practice now. It humbles me to know that you have confidence in me to deliver such an important message to all of you, clinicians and healthcare professionals with far more experience than I have. I bet you're all wondering why I'm here though. Why would they choose one of your final speakers of the day to be a relatively inexperienced clinician? Think back to why you started this field in the first place. I am a representation and a reminder of that. And I am here to get you to think like that inspired and idealistic new clinician once again, and really see your patients through their eyes instead of just your own. I'm going to reflect and discuss on events in my life that led to a single moment of clarity, which helped me find purpose. Through struggle, loss, growth, and transformation, I have discovered that my purpose in this life is to share my vision with others and use it to help influence my patients, my coworkers, and my own life for the better. To my benefit, and actually my future patients' benefits, the PT professors at Grand Valley highly stress the importance of reflection in our coursework. And one of the ways that I was able to apply reflection to healthcare came with an assignment that I was giving during my second year of PT school. And chronologically speaking, this was right after I finished my counseling and truly discovered my passion for writing. We were given an assignment in which we had to read one book from a long list of memoirs about patients' experiences with specific neurological diagnoses. So as a student who always required more time than most to complete assignments, I quickly skimmed the list and I chose the book that was the shortest in length. I noticed that The Diving Bell and the Butterfly by Jean-Dominique Bauby consisted of only 132 pages and really large print at that. I did not consider the content of the book, nor did I consider who wrote it or why he even wrote it. I knew I would be able to complete this assignment in one sitting and check off the completion of it and leave time for more important assignments. To me, the only intriguing part about this assignment was the fact that I would get to reflect. After I read The Diving Bell and the Butterfly, I felt ashamed of myself for choosing it for only its short length. But upon reading the last line of Bobby's book, I had gained an appreciation for the time that he took to tell his story, and an appreciation on the incredible patience and dedication on the part of the clinicians that were involved in his care. But I unexpectedly gained a new perspective of a patient and his journey, ultimately changing my perception of the clinician that I envisioned myself to be. I really surprised myself with how meaningful I found this assignment to be. And as I read his book and started applying concepts to my own life, personally and professionally, I started to realize that if we as clinicians are going to change anything about the way in which we serve our patients, we have to start looking within. What if we started looking at our patients' cases as puzzles to solve? And where would you start the build of that puzzle?
Imagine yourself actually sitting at a table, putting together a 1,000-piece cardboard puzzle. The easiest way to start solving the puzzle would be to identify the corner pieces, find the straight edges, and, in an orderly fashion, put together the perimeter. With this strategy, we give the puzzle structure. We would then work our way into the middle, piecing together similar pictures and building designs. We would start to see trends in the puzzle and catch on to related patterns. When it comes time to snap the last piece into place, we feel satisfied because we have accomplished the task of identifying scattered pieces and fitting them together to make a substantial whole. I ask you though, what if we changed our strategy and started our build of the puzzle from the inside and worked our way to the outside? What would happen if we did not start building and piecing together the puzzle with the structure of a perimeter, or in our case as clinicians, the structure of a diagnosis? Would we be able to understand where to go from there? How could we determine our next step? It would be more difficult. It would take more effort out of us, but it would get us to the end. We would be able to stand tall with our finished product. Our job description requires us to dig deep and somehow relate our own experiences, no matter the severity, with those of our patients. We must find a way to understand their pain, see what they have lost through their eyes, and then be capable of guiding them to a healed status. Imagine that while every other healthcare worker was sifting through diagnoses, you were the one looking at the patient. You started building the patient's treatment from the inside out.
As healthcare professionals, we carry a ton of responsibility, but with that we also carry a great load of opportunity. We have the opportunity to help shape a person's life and promote change from the moment in which we come into contact with them. And how unique is that? To be able to do that as a job. And what an opportunity it is to be able to help someone make their life better, because on a daily basis, we pass on our knowledge and our skill. As we gain experience, though, there is that possibility to lose that open-mindedness that keeps looking for opportunities, that inquisitive nature that never stops asking why and what else, and that determination that truly delivers the very best care to patients. But I am thinking that there has to be a way to hold on to that frame of mind and then add it to the years of experience that we already have. What an incredibly productive combination that would be.
To stay in this frame of mind and not lose it, we have to keep asking ourselves again and again and again, did I reflectively listen to someone today? Did I help change someone's outcome today? Did I positively influence a life today? And let me add, did you allow that life to be your own? Will you allow your patients to positively impact your own? Over the course of 1 year of clinical practice, I've learned something from every single one of my patients, because I get to witness people rising from the bottom and working their way up to the top. As healthcare professionals, we get to witness people fighting for something when there are absolutely no guarantees. And seeing that every day allows me to rise. My patients and I, my coworkers and I, we hold each other up. And this is why we entered this field in the first place. To witness the beauty of people when they hold each other up. We will improve our quality of care and our productivity if we are always reflecting on our practice. As Jean-Dominique Bobby intelligently said, we must keep looking. And I say, as compassionate caregivers, we must dictate the direction